Thanks, Dr. Henry. Welcome, everybody. I think we're 1 minute ahead of time, so everyone stand up and stretch. We had a very long afternoon, and we have a couple more presentations, so I'll give you 20, 30 seconds, and we'll get going. So while we do this, I see some people with a little bit more energy here in the fourth row, and so that's great. Again, on behalf of the Professional Development Committee and developing the TEC Talks, it is truly my honor to introduce our next speaker, Dr. Sarah Greenberg. Dr. Greenberg is a pediatric surgeon at Seattle Children's Hospital, as well as an assistant professor at the University of Washington School of Medicine. In addition to her really busy clinical practice, she primarily focuses on work around equity, global surgery, and planetary health. She is presenting today's TEC Talk on OR sustainability on behalf of and in conjunction with APSA Sustainability Subcommittee. So please welcome Dr. Greenberg.
Thank you, Dr. Lee, and thank you for the opportunity to discuss OR sustainability, the intersection of equity, climate change, and children's surgery on behalf of APSA's Sustainability Subcommittee. I have nothing to disclose. Why are we talking about climate change at a pediatric surgical meeting, you might ask? Climate change is a significant and rising challenge that affects human health, including surgical disease and health equity. Ironically, the delivery of surgical care needed to treat the health results of climate change has deleterious planetary effects. However, the relationship between climate change, pediatric surgery, and equity is rarely discussed, despite the existence of known mitigation and adaptation strategies. Furthermore, APSA has the motto of saving lives. It has delved further into this by committing to address social determinants, reduce health disparities, combat racism, and advance social justice in order to help ensure that all children have access to health and prosperity. I would argue that this cannot be done without a focus not only on sustainability, but ideally on one that delves further into reciprocity, restoration, and regeneration. From a personal standpoint, in this interconnected world, I struggle with the following. If I operate and subsequently save the life of a child, but do so without a focus on sustainability, and therefore harm the earth, what have I truly done? How have I affected the future and present life of that child and the life of others? Whose lifetimes have I truly affected, and in what way? This is a very large topic, and I'm not going to go into depth regarding any one part, but rather will skim the surface of many different components and provide additional resources and mechanisms for those who wish to learn more. Intensifying heat waves, wildfires, floods, droughts, and infectious diseases fueled by climate change have marked these past years. These changes are largely anthropogenic and are inequitably created and experienced. In 2021, the Lancet Countdown, which is a global multidisciplinary collaboration that monitors the health effects of climate change, labeled this state a code red for a healthy future. That same year, an editorial was published by the editors of 18 prominent medical journals on your right, included the New England Journal of Medicine, the BMJ, and the Lancet. And they wrote that the greatest threat to global public health is the continued failure of world leaders to keep the global temperature rise below 1.5 degrees Celsius. Climate change also affects pediatric surgical disease. For example, the expertise of a surgical team is needed to treat physical injuries from weather events. Malnutrition from altered food supplies affects wound healing. Prenatal exposure to severe heat, air pollution, and infectious diseases has associations with low birth weight, prematurity, and congenital anomalies. Climate-associated increase in respiratory illness influences perioperative risk, and access to surgery is also frequently affected, which affects not only the individual morbidity and mortality of children, but also the economic productivity of the community and country in which they live. And the reality is, not everyone will care about health, but most people will care about money. And all of these things together can generate ongoing and growing cycles of ill health, poverty, political instability, and subsequent further climate vulnerability. Most of this is felt by children. Globally, children are estimated to bear 88% of the global burden of disease due to climate change. And there's a number of reasons for this, including their increased physical and psychological immaturity and vulnerability compared to adults, as well as their increased exposure risk to climate elements, both through their reliance on caretakers, as well as their geographic location throughout the world. This is a map of youth dependency ratios, looking at the ratio of people younger than 15 years to those ages 15 to 64. And you can see there's a higher youth dependency ratio in areas with the deeper blue color. The distribution of this map closely resembles others that delineate climate risk, such as this map, published by the Intergovernmental Panel on Climate Change, which contextualizes the disproportionate impact of climate change globally. Susceptibility is demonstrated by the deeper red colors. The United States, which has contributed the most carbon dioxide to the atmosphere of any high-income country, is among the least vulnerable nations to the effect of climate change. These inequities are not just global, however, but also very much local. In the United States, there are significant racial and class-based inequities seen in the effects of climate change due to historic and current housing and land use policies and differences in exposure to pollution and toxic chemicals, differences that are rooted in bias, racism, discrimination, and colonization. Ironically, delivery of the services needed to treat many of the health impacts of climate change are also deleterious to the environment. The healthcare sector globally is responsible for approximately 4.5% of overall global greenhouse gas emissions. Surgery leads this negative impact because it's highly resource intensive, generates a large volume of waste, and utilizes volatile anesthetics, which are potent greenhouse gases. Operating rooms on average are 3 to 6 times more energy intensive than hospitals as a whole and produce the majority of hospital waste. These numbers, in my opinion, challenge the premise of first, do no harm. This is a visual depiction of waste generation from surgery, which, as you know, uses many single-use items. This picture was created by a Dutch artist who formed it using all of the disposable items from her own breast reconstruction surgery. Despite the environmental impacts of delivery of surgical services, there are also many proven mitigation strategies. In a recent scoping review, Dr. Sullivan and her team identified successfully implemented quality improvement initiatives that reduced both cost and environmental impact. They grouped these interventions into the 5 R's of sustainability: refuse, reduce, reuse, repurpose, and recycle. The graph you see on the inner circle shows the percentage inclusion of each category, and the outer circle has specific interventions. These interventions were found to save between $800,000 and $700,000 per year, dependent on the intervention itself. To further highlight some of these strategies, ABSA has also created a sustainability toolkit for the operating room, which you can find via the link on the screen or the QR code. And it has a lot of information there, but it includes steps that can help create a green OR environment and delineates high-impact interventions. Much of which has been presented today has been via a typical Western scientific approach. However, I want to acknowledge that how to truly coexist in this world and protect the earth and those who live on it is deeply rooted in many indigenous communities and held extensively through traditional ecologic knowledge, a different TEC or TEK than this TEC Talk. For the last few minutes of this talk, I'll focus on a successful case example from Seattle Children's Hospital, which is the quaternary care facility which aims to serve a quarter of the U.S. landmass. It holds a number of institutional, state, and national commitments to mitigate the environmental impacts of healthcare delivery, including a primary institutional goal of becoming carbon neutral by 2025. This individual is Dr. Liz Hansen, who's a pediatric anesthesiologist at Seattle Children's, and she took a look at the breakdown of carbon emissions at our hospital, which is demonstrated in terms of the breakdown in 2018, and noted that a significant volume was secondary to anesthetic gases. Anesthetic emissions are high because inhaled anesthetic agents are potent greenhouse gases. Desflurane and nitric oxide are particularly harmful due to their high global warming potential with desflurane and long atmospheric lifetime with nitrous oxide. When used, most of the waste gas is not metabolized, and the majority of it, 95%, is vented directly into the atmosphere. And so Dr. Hansen took this problem of high greenhouse gas emissions and looked at the various causes related to people, materials, equipment, and processes, and found that there was not much knowledge about this. There was high use of nitrous oxide and desflurane. There was defaults such as anesthesia machines using high fresh gas flows, and there were preferences towards things such as inhalation inductions. And so she took this information and developed a three-prong intervention, starting with education, leading to a number of practice constraints, including desflurane vaporizer removal, lowering fresh gas flow defaults, eliminating nitrous oxide, and promoting total IV anesthesia maintenance. And with this is what she found, with changes in emissions on the y-axis and time on the right. And each intervention stage has a different color, with baseline in blue, socialization or education in green, practice constraints in yellow, and data feedback in purple. And overall, what was found, or what was experienced, was a six-fold or 87% reduction in measured greenhouse gas emissions from inhaled anesthetic agents, which was also associated with an annual cost savings of $140,000. This is just one example of a successful and cost-effective intervention, which has turned into a multi-institutional, multi-center, or multi-country study called Project Spruce. In conclusion, climate change affects pediatric surgical disease, and delivery of surgical services affect climate change. Those effects are inequitably distributed and rooted in the same injustices and inequities that permeate both our local and global societies. There are effective ways to mitigate the deleterious effects of delivery of surgical services that may vary depending on location, resource availability, and provider priorities. Truly improving lifetimes will require a sustained and tailored focus on mitigating the environmental impact of delivery of surgical services. I want to thank our Sustainability Subcommittee, which is led by Dr. Linda Lee. The members of the committee are listed here. And if you are interested in delving into this further, don't hesitate to reach out to any of us. Or there is also an upcoming breakout session later today on how to operate with less. Thank you very much. Yes.
Do we have time for a question? Okay. Thank you so much, Sarah. That was a wonderful talk. I just had a quick question about, if I was interested in doing something like what you have done at my hospital, how would I get started? Like, who would be the right people in the room to talk to?
I think it would be very institutional dependent. If you had a sustainability leader, which some hospitals have, I would start with that individual. Otherwise, I would start with people who felt like held leadership positions and then go to them and frame the problem in a way in which you think that they would care about, whether it's secondary to advocacy, policy, outcomes, cost, etc., and do so with the support of people who are doing the work either at your institution or at others who have been able to navigate similar settings successfully.
Thanks so much. Thanks for giving that talk on such an incredibly important topic.
Thank you all.
Great. Thank you, Dr. Greenberg.